All right, everybody. Dr. Rafich here from Vet Triage. It is Thanksgiving. Happy Thanksgiving for everybody. Thursday, November 28th, 2024, 9:14 a.m. Pacific time. We are going through this issue of veterinary surgery, May 2015 issue, and we're talking about this study, three-dimensional morphologic analysis of the lateral surface of the canine femur. This comes out of two universities, the University of Illinois and the University of Michigan State rather. All right, objectives. Analyze the lateral plating surface of the femur to obtain bend and twist angles in dogs with non-chondrodystrophic phenotype. So bending, obviously this is bend, twist is twist, and then non-chondrodystrophic means those dogs that have bones that are not like bulldogs and dachshunds and things like that, pugs, French bulldogs, the whole bow-legged thing. We're looking for more normal, standardized structures to their bones. This is a retrospective CT morphologic analysis. They're using 30 limbs. They identified 13 points of interest, and their respective bend twist angles were identified on the lateral surface. The coefficient of variation of the bending ranged from 17% to 46%, and for twisting, 21% to 58%. The greater trochanter was the most pronounced bend on the lateral surface of the femur, with a 8.11 degree and a coefficient of variation of 17%. So that's pretty obvious. We'll show you the picture in a minute here, but the greater trochanter should be the greatest bend because it's a very pronounced bone. The supracondylar region of the distal femur was the most marked twist at a 48.98 degrees and a coefficient of variation of 21%. And that also makes sense as the femur, as you go towards the distal end of the femur, it goes from straight to starts to like twist. And that makes sense because that's where the stifle joint is going to begin. Although there were no differences between dogs in proximal femur anatomy, two clusters of 9 and 21 dogs in each cluster were identified due to differences in bend twist angles in the distal femur. Their conclusion was, although distal femoral lateral surfaces varied sufficiently to result in two population clusters, further analysis is needed to determine if the differences prevent using the mean bending and twisting parameters as a template for clinical applications. Also, a common, I guess, error, maybe it's not an error, but for using the word femur as a singular, and then for plural, they're using femurs. And I was always taught it was femora for the plural. So maybe it's changed, maybe I'm wrong. Okay, introduction. Improper contouring may cause loss of fracture reduction, create stress concentrating areas, and potential increase of implant failure and malunion. Interference with correct patellar tracking and post-operative patellar luxation, as well as suboptimal screw purchases. These are all risks if you can't bend the bone plate to the bone accurately. Locking screws must be positioned perpendicular to the plate, making accurate twisting of the plate essential to restore normal rotational alignment in some bones. A previous study compared locking compression plates applied at different distances, meaning flush to the bone, 2 millimeters off the bone, 5 millimeters off the bone, with a dynamic compression plate. They found comparable biomechanical behavior in both constructs when the plate were applied at or at least 2 millimeters from the bone. Locking compression plates placed 5 millimeter off the cortex showed increased plastic deformation, lower failure loads, reinforcing the necessity of some contouring even when locking instrumentation is used. Similarly, in a human cadaver study, 5 millimeter offset of both conventional and locking plates produce a lever arm effect at the unsupported free part of the screws that compromise the mechanical behavior of the elevated constructs. Plates can be contoured to match a template shaped to the bone during open reduction. However, this may extend surgical time and increase morbidity. Plates can also be contoured preoperatively to match anatomic specimen of appropriate size or similar size synthetic bone model, but this requires you having bones available. True size radiographic images of the contralateral intact bone may be used as a template for bending the plate, but it does not provide information on twisting, which must be performed during surgery, especially if dynamic compression plates are used, where exact contouring is required. Recently, sophisticated computer programs have been developed to allow surgical planning from images obtained from CT. This method is useful for maxillofacial surgery and articular osteosynthesis in people, where precision is paramount to achieving anatomic reconstruction. Acquiring preoperative CT scans with animals with fractures may be cost prohibitive. Minimally invasive percutaneous osteosynthesis does not allow intraoperative plate contouring to the bone surface. Commercially available pre-contoured plates are used in people, and preoperatively contoured plates are used in dogs and cats. Commercially available pre-contoured plates may not be accurate. An anatomical study of human cadavers found that pre-contoured locking femoral plates designed for Caucasians did not match the anatomy of Asians, and it suggests that their application could cause malalignment of the fracture site and potential valgus deformity. Similar issues may occur when using bone specimen templates due to the variability in size. However, in a study of children, despite not matching the age and height of the template cadaver with the subject's fractured bone, the anatomy of the distal femur was consistent enough that malalignment did not occur. Canine femora were similar in shape regardless of dog size based on two-dimensional radiographic morphologic analyses. So materials and methods, these cadavers were between January 2005 to 2012. Images were excluded if the femur was incomplete, if the femur images were incomplete, if there was evidence of bilateral femoral disease, trauma, cancer, or the image was from a skeletally immature dog, meaning a dog with open physes. 10 points of interest were identified in the lateral surface of each femur to describe the bending profile. So this is the imaging here. So I don't know if you can see the numbers are very tiny, but there's numbers on there, and that's where they try to assess the bending and twisting areas. And if you look at point number 1 there, pointing at the greater trochanter, right? That's one that had the largest bend to it, and so that's pretty cool there. And then here you can see I pointed arrows that, and we'll go over this in a minute here. The arrow on this side is the greatest twist, and the one on this side is the greatest bend. And so that's the picture there. Results. Labrador Retrievers made up 9 dogs. Mixed breed was 4. Golden was 3. The mean age was 6 years. The mean body weight, 36.3 kilograms. The coefficient of variation of all measured bending angles ranged from 17% to 46%. And for the twist range for 21 to 58%. Bend 3 at the trochanter was the most pronounced based on the lateral surface of the femur with a 8.11 degree coefficient of variation of 17%, and twist 12 at the supracondylar region of the distal femur was the most marked twist. Profiles of the means of the standardized angles differed significantly between clusters. There were 9 and 21 dogs in clusters 1 and 2, respectively. Bend 7 and Bend 13 differed significantly, indicating the distal femurs, see there it is, femora, was best separated into 2 groups to achieve homogeneity. 90% of the femurs were correctly classified into one of the 2 clusters, further confirming the appropriate number of clusters. Okay, discussion. The results of the study provide the first step in developing a database of femoral bending and twisting angles for potential use as a reference for preoperative contouring of available plates. We tried to account for the variation in dog size and morphology by including 30 dogs of variable body size representing 16 different breeds. Repeating these measurements in a larger cohort with a large number of dogs for each breed may provide a more representative reference range. The bending angles of the lateral surface of the proximal femur was similar for all specimens, with the most pronounced bend being located at the greater trochanter. The wide range and the coefficient of variability suggests variability in bend and twist angles of the lateral surface of the femur between the specimens, resulting in clusters into 2 groups. The bending angles obtained at the distal femur as well as the twisting angles was statistically different between the clusters. An earlier study focused on radiographic images of the proximal femur to identify similarities and facilitate hip prosthesis design. Also found that canine femurs were similar in shape regardless of breed size or age of the dog. The twist in distal femur 0.13 yielded the highest variability among the points of interest, but may simply reflect the natural curve of the caudal surface of the bone rather than a true twist. This may not be important clinically since a bone plate would generally not be placed in this area. The smaller of the two clusters included 9 femurs, which represent 30% of the total population. Surprisingly, the only significant demographic difference between clusters was weight. Femurs from heavier dogs were grouped into cluster 1, lighter dogs cluster 2, regardless of breed. It is possible that the increased axial load in heavier dogs could stimulate remodeling of the bone to adapt to heavier loads, and that's Wolff's law, resulting in small but statistically significant differences between two clusters. However, the small sample size in each cluster makes it difficult to test any hypothesis. Further studies needed to determine if the bending angles of the proximal femur can serve as an accurate reference for pre-contouring bone plates. Currently, the available literature does not address differences between proximal and distal femur, different breeds, or different body condition of dogs of the same breed. And that's it. Pretty straightforward study. Fracture repair has been becoming more sophisticated over time with more emphasis on accuracy. So it's interesting that they only looked at the lateral surface of the femur here. And I understand why. If you're going to place a plate in the femur, it's usually on the lateral surface, meaning the outside part of the femur. However, it would have been cool to make it a kind of a complete, thorough study where you did 360 degrees involving the femur, but they wanted to keep it clinically applicable. So that's probably why they did it that way. And of course, as any other study, usually the criticism is you need more dogs. So it'd be good to have a larger study for that. All right. And it'd be cool actually if they compared those dogs with CT versus radiographs as well. All right. We'll see you guys again tomorrow. Happy Thanksgiving. Be safe out there, and we'll see you tomorrow. Thanks.